Hi, I am Dr. Ruth Wolever. I'm from Duke Integrative Medicine, and I'm a health psychologist by training. I do research, clinical research, and practice psychotherapy with a lot of mind-body influence. You know, in conventional biomedicine, the sort of gold standard of randomized controlled trials is built around this process of analysis and isolation, where what you do is you try to get everything as standardized as possible. You control the variance as much as possible so that when you implement a treatment, you're able to say with a good degree of certainty that the change was related to one particular thing. So you control everything, and then you're able to, in isolation, say A led to B. Well, the problem, or it's incredibly useful. Obviously, we need randomized controlled trials. But the problem is that as you, as a researcher, are trying to standardize everything, you end up with really homogeneous populations that you are studying. So, because you're more likely to see the effect of a treatment if you have all the other variants equalized. Well, what that means is that the trials are really include people that are extremely similar in a lot of ways. And, you know, people are complex. So there are many, many things that we're not going to be able to study like that. You know, so for example, as a psychotherapist, if I want to know if a particular treatment is going to work with a given individual, and I'm trying to control all variants, I would have to exclude, for example, anybody that's on antidepressant medication. Well, that's a huge percentage of people right there. So in the real world, what happens is you have much more complex situations. And case reports can really capture the complexity of individuals and the trajectory for them. The other thing is that with randomized controlled trials, having that as a gold standard is useful, but it should only be one of the standards. Because in addition to case reports being able to offer really rich observational examples that might lead to randomized clinical trials later, the other thing that's important is that randomized controlled trials will never be done for many, many things, for several reasons, some practical reasons. And let me just give you an example from my own life. So my delightful daughter has a neurological condition called Rett syndrome, R-E-T-T, Rett syndrome. And she, when she was about 5 years old, was one of the components of the syndrome is significant seizure disorder. And she, you know, through fabulous clinicians that were trying very hard, she was on enormous amounts of medication. You know, she was taking Depakote and Lamictal and Lyrica and Klonopin in huge doses for a 5-year-old. And we were really not getting anywhere. And her really wonderful pediatric neurologist suggested that we try an infusion of, an IV infusion of gamma globulin. So this IVG treatment, however, is expensive. And we asked for, you know, permission. The first dose of it was given while she was hospitalized, and so it was, I guess, easier to get approval for it. Well, she had had between 8 and 15 seizures a day for months, for over a year, even with this incredible medication load on board. Within 5 days after the infusion of the IVG, she went 40 days with no seizure whatsoever. And it was incredible. She was like, she found her personality again, and she was laughing and learning again. It was amazing. And then we went to the insurance company to say, wow, this is significant. We need to do, you know, regular infusions at the rate that the physician prescribed. And the reason they used to deny it, because it's an expensive treatment, like $3,000 an infusion or so, the reason they used to deny it is there are no large-scale randomized controlled trials. There will never be a large-scale randomized controlled trial for IVIG for girls with Rett syndrome. So first of all, you know, who would fund it? There's not a huge population out there. The second issue is the recruitment would be impossible. So there's some real practical barriers to having large-scale prospective randomized controlled trials be the standard by which everything is modeled. So there are many reasons that large-scale prospective randomized controlled trials, while they're really important, they can't be the only standard. I mean, one is a funding issue. As I said, who's going to fund a large-scale randomized controlled trial treatment of IVG? It's a off-label use of a drug, so the drug companies aren't going to be invested in necessarily, using it for a really small population. Recruitment would be a challenging issue. So, in this situation where large-scale prospective randomized controlled trials was being touted as the reason to deny, the lack of them being touted as a reason to deny the treatment, and really it's a misuse of science. So by having things like case reports that are well done, by having observational trials in certain natural settings also that are well done, we develop a much richer standard for gaining evidence and being thoughtful about what we use to make the decisions we use.